Getting a medical diagnosis for a health condition can be complicated, but diagnosing dementia doesn't have to be. Although there are different causes, they all share certain features. They are caused by lasting changes in the brain that affect mental abilities and day-to-day functioning, and they aren't reversed by treating some other medical or psychiatric condition. Dementia can affect anyone, though it's most common in older adults. Although many conditions can affect mental abilities, the term dementia is reserved for conditions specific to the brain itself. Usually, diseases like Alzheimer's, Lewy body, or vascular disease, or serious brain injury. You might think that diagnosing dementia starts with specialized tests, like brain scans or blood tests. It doesn't. It starts with stories about what you're experiencing now, your background, and your functioning. These make up what we call a medical history. A good history considers what you say, what someone who knows you well can share, what medical conditions you have. And this includes common problems like depression, long-term sleep loss, poor hearing or vision, and certain medications that can dull the mind. When changes occur in someone who seems too young for dementia, or when changes get worse quickly, we usually look for other problems. An initial diagnosis of dementia is based on 3 simple steps. 1. Evidence that mental abilities, thinking clearly, remembering, communicating thoughts, or making decisions, for example, aren't as good as they used to be, and usually you and others know it. 2. The change is lasting and makes it harder to keep up with your usual day-to-day tasks. And 3. The problem is not caused by diseases outside the brain or a psychiatric condition, or reversed by treating such conditions. To get at the evidence part, clinicians, like physicians or psychologists, often use thinking and memory tests. There are many different tests that can help with this. A brief test may be all that's needed to confirm a problem, but longer, more complicated tests are used if the problem is mild or easy to miss. And if specialized medical tests like brain imaging and new kinds of blood tests are needed to make good decisions about treatment, they come later, after the initial diagnosis. Talking to a doctor matters. When changes are caused by brain effects of other conditions, treatment can sometimes bring dramatic improvement. And if it is dementia, there is much that you and those around you can do to sustain health and well-being. We call this living well with dementia. For more information about our center and our work, please visit bolddementiadetection.org.